السلام عليكم. مرحبا بالجميع. Hello everyone. Welcome to this very important webinar about leveraging AI in medical education. On behalf of IEEE Jordan section, I'd like to welcome all the attendees, and I'd like also to thank our speaker, Dr. AlSheikh, in this important talk. First of all, I'll have like 5 minutes introduction about IEEE and about the speaker. Then we can start in the presentation. So basically, this session is organized by IEEE Jordan section. This is the link for the official website for IEEE Jordan section. So if you are interested to know more about the section, you can go to this link or scan the QR code. Basically, IEEE as an organization was established its roots back to 1884. That's 140 years ago. But its official name as IEEE was given in 1963. Now, this is the map showing the distribution of IEEE over the world. It's a worldwide organization. Now we have 477,000 members worldwide. Jordan and Saudi Arabia, we are both a part of Region 8. So basically, this Region 8 is shown, in orange, and we have statistics about this region to the right-hand side of the screen. And we'll make sure this presentation will be available to the audience. This diagram shows the distribution of membership growth over the years. And this year, and still, we have still like 1 month to finish this year, we have 3,277 members, in Jordan, across different membership grades. In Jordan, we have 6 technical professional chapters across these areas of interest. We have also 3 affinity groups: women engineering, life members, and young professionals. And we have branches in 21 Jordanian universities. So we are there, in many universities, and we'll happy, to hear more about IEEE if you are from outside engineering or IT background, because I think many of our audience today are from medical background. These are the branches, and as you can see, in each branch, we have also technical cities in each universities. Overall, we have 70 technical cities across the 21 branches. Now, IEEE in Jordan is called IEEE Jordan section, but this session, this webinar, is organized by a local group. The local group is called IEEE Jordan AI, Machine Learning, Deep Learning, Computer Vision, and Large Language Model Group. The founders of this group, myself, Musa Al-Akhras, and my colleague, Hisham Al-Muaqqat, and this is the link if you'd like to join the group. By the way, even if you are not member of IEEE, you can still join this group. I am Musa Al-Akhras, the founder of this group. I'm also the chair of IEEE Jordan section. Now, our talk today will be about leveraging AI in medical education, and we are happy to have Dr. AlSheikh with us as our main speaker. I'll just give a few introduction about a few words about Dr. AlSheikh, because mashallah, she has very impressive CV. Dr. Hmoud Sheikh, MBBS, PhD in physiology, MHPE, FF, academic accreditation and assessment, Kiel University, diploma in AI. She's an associate professor. She's the head of the research and innovation unit. She's also the vice president of Saudi Society for Medical Education. Dr. AlSheikh is an associate professor in neurophysiology, holds the position of the vice president of Saudi Society of Medical Education. She's also the head of the research and innovative unit in the College of Medicine at Imam Abdurrahman bin Faisal University, IAU. She's also a certified accreditation reviewer with the National Education and Training Evaluation Commission since 2012, a member in the Central Assessment Committee, a previous chair of Medical Education Department, and head of Examination Center, College of Medicine at Imam Abdurrahman bin Faisal University. Her main achievements are establishment of the Medical Education Department, the Faculty Development Program, Interprofessional ESHBE course, and the Examination Center in the Medical College of IAU. Dr. Mona achieved the first position in the kingdom in higher school. So she was the first across all the kingdom in higher school education. After that, she got MBBS, Bachelor in Medicine with distinction, PhD in Neurophysiology, Master in Health Professional Education, MHPE, Advanced Assessment Certification, Center of Medical Education, University of Dundee, Scotland, was involved in 3 higher education equality tours with QAA and NCAA of UK universities, Philadelphia Famer Fellowship in 2019, item Bank Administration Certificate from CUHK, postgraduate degree in assessment and accreditation from Keele University, and diploma in AI and Python programming from Plymouth University in the UK. She teaches undergraduate and postgraduate medical students and supervises master and PhD physiology and medical education students. She has published over 100 articles in reputable journals and conferences, is a reviewer in many education and medical journals and conferences, and has achieved a Prince Mohammed bin Fahd Award for scientific research. Her main research interests are learning theories and cognition, assessment and competency-based education. Mona has joined ASU MENA Fry faculty from 20 till 2024. So please join me in a virtual welcoming Dr. Mona. Dr. Mona, thank you again for being with us today. And we are all listening and looking forward for this important presentation. Now you are the host and you are listening to your important presentation. Thank you again.
Assalamu alaikum wa rahmatullahi wa barakatuh. It's my honor to be with this prestigious group, and I'm very glad to see this momentum in Jordan about AI and about technology in education. My talk is going to be about leveraging AI in medical education and healthcare, and I hope that I will add something new. I know, to me, Jordan as a country, even lay people are very high-tech persons. So I have cousins in Jordan, and they are very, I think, advanced in that domain. I hope I can add something to what you know, and I hope you enjoy it, because in my college, my students and they call me the advocate of enjoy. I tell my students, unless you enjoy learning, you will never keep doing it. So today's talk is going to be on 3 main objectives: the educational feedback and personal tutor. We will talk about assessment, the role of AI in assessment, and the role of AI in healthcare. And as I was, we just came back from Jizan. We had the Saudi International Medical Education Conference, and I just gave a comment there, just talking about AI as one entity is wrong. It's like saying a student. AI now have so many different entities with different capabilities and abilities, and I hope that I can add a recent research which was accepted but not yet published about that issue. So when we talk about AI, we have to segregate. Chatbot 4.0 is different from Gemini, is different from Cloud 3, and so on. So as an introduction, let's just go as a bird's eye view of what AI has changed in our higher education. So to me, the best thing is the intelligent tutoring system. I mean, we do give tutorials as instructors, but are we there 24/7 to our students? No, we cannot afford to do that, no matter how large a faculty manpower we have. Number 2, data synthesis and analysis. Now, do we need data in order to design proper courses or measure learning achievement? Yes, of course. Adaptive testing, and by that we mean that not only we are creating tests, but the tests can change their difficulty according to the performance of the student. Collaborative learning. Now, the theme of the CIMIC 2024 that I just told you about was interprofessional education and collaborative practice. And here we mean that AI and technology in general has helped us in implementing IEEE, or interprofessional education, and collaborative practice. Analysis of practical skills. We have a great challenge as physicians in how to measure clinical skills, how to measure values or attitudes. So AI can help us doing that. Learning analytics. We can not only, for example, when I was working in the Vice Dean of Academic Affairs, the challenge was how to support the low-performing students. So we needed to diagnose who are the low-performing students. And in order to do that, the only indicator we had was the scores of the quizzes or the exams. Now, with using AI, we can even predict those students before they even take any quiz or any exam or any assignment, and we can help them or prevent their failure, if I may say. Item generation and scoring, and I'll tell you our experience with that. And then clinical reasoning. I think if we only graduate students who can do clinical reasoning, who can use algorithms to reach a diagnosis or a decision in the shortest way possible, then that's enough. And I just remembered now the paper by Dunning, in which he said our students are 4 categories. We have the empty mind, which we almost graduate 0 with empty mind. The second group is called the cluttered mind. Those are the ones who take their information from the internet, from here and there, but they don't have it organized in a way which they can use it properly when they need it. And that, to me, is a big category of our students, 70 to 80%, depending on the college, of course, or the program. The third group is called the elaborate mind. And if I graduate my students, of my graduates are all of the elaborate mind, I've done my job. Elaborate mind means a student who has his information very well organized, just like a secretary who has a filing cabinet where every paper and every letter, the input and output are with dates, with subjects, and they are classified. So if her boss asks her for any letter that came from the dean last week, she can easily, in 1 second, pick it up. That is the elaborate mind. A person who has information that is very well organized in schemata, and whenever he needs to pick up an information or use it in an exam or in a practice, it is there for them. What is the 4th category? I told you 4 categories. I only mentioned 3. The 4th category is the intuitive mind. And we should not be very ambitious to say that we can graduate intuitive mind, because intuition comes with experience. So a resident who practices for 4 years, then he practices another 3 years to become a consultant, and then he practices as a consultant for 5 years. He has seen enough to have intuition about diagnosis and management, personalized management of a patient. So this, I just remembered this now. It's not part of my lecture, but I think it's interesting. Right, so this is a list of opportunities which we can use AI for. And I just highlight in red that efficient exam preparation with timely, elaborate, narrative feedback, and with analysis of learning trends. This is one of the most important gains that we can get from AI incorporation. Now, the National Academy of Medicine has created a report called Artificial Intelligence in Healthcare. And in this, it has created, or it has listed a report. It has listed some aspects, and one of them, I just make it in big: develop and deploy appropriate training and educational programs. So this is like a priority now. We need to have to incorporate AI training for the faculty and the students in the faculty development program and in the curriculum. And this is why now many regulatory bodies are updating the framework for medical education and health profession education in general. And this is actually indeed going on in the Saudi Commission as well, to incorporate those emerging trends. And the most important emerging trend is AI. The AMA, or the American Medical Association, has launched 7 web-based modules. And look at the first one, Introduction to AI, because nobody can now ignore AI as a major tool that can make your life easier as a learner or as an instructor. The new journal, New England Journal of Medicine, launched a big survey called AI and Medical Education. And oh no, this is a paper which is, I like the title of this paper. It said AI and Medical Education, a 21st Century Pandora Box. So we still don't know how much AI can give us or can take from us, actually. And this paper has mentioned, these are the authors. It's July 2023, so it's not very recent. But the beauty, I've read the paper, and I just give you the the highlights, that using AI in learning can change the thought structures of the learners. And to me, this is a major can change the practice patterns of our physicians in the future. And I think this is a major gain from AI, provided it's used in the proper way. Now, the New England Journal of Medicine as well made a huge poll with hundreds of thousands of educators and found out the question was, what are the top 2 topics that medical schools should focus on to prepare students to succeed? And number 2, with 34% of the participants, said data science, including artificial intelligence and machine learning. So now everybody recognizes AI and technology as a major issue. So the question that is raised, how can we incorporate AI in our curricula? If we recognize it as an important tool, as an important component of any learner, medical education learner or health profession education learner, how can we incorporate it? So one suggestion was just to put a course or a module on artificial intelligence, just like we have done with patient safety, just like we have done with ethics and so on. But it will be a solid module on its own, not interacting with the other modules. So it will be something like this. Look at the red color here. It's separate. It's not merging with the green or blue. So it's on its own in a silo. This is what we will do if we add it as a module, as a separate module. The second option is to add it in the foundation year and the preparatory year for the health profession. And this is a paper teaching artificial intelligence as a fundamental tool set of medicine. This is also good. So you are saying, I will not allow my students to start their college years unless they have a preliminary minimal competence in artificial intelligence. That's again good. But do you think, does this ensure that we are using it in clinical science and basic science and health system? That's the second option. The third option, which I prefer, is to have artificial intelligence, AI, as a theme across all modules or courses, all assignments or assessments, and all active teamwork or PBLs. So I think by this way, we ensure that AI is really, weaved within the curriculum, just like this red color here, how it is weaved with all the other colors in this piecework. Now, the competencies for the artificial intelligence have been already explicitly formulated. So into 5 domains: basic knowledge of AI, social and ethical implications, workflow analysis for AI-based tools, AI-enhanced clinical encounters, evidence-based evaluation of AI-based tools. So there are 5 main competencies under which I can put my learning outcomes. The formulation of the competence is an important step, is a major step. And if you look at this, roadmap to incorporating AI, the first one is to create the awareness of the stakeholders, the importance of AI, just like we are doing now. The second one is formulating the learning objectives, which I have just shown you. So it's really a major step. Then we need to develop competencies and curricula which incorporate those competencies. So we need to revise our curricula, develop our curricula in order to adopt these competencies, not only in the PLOs and CLOs, but also to create pedagogical approaches that make sure that the learner is incorporating those skills and knowledge, and to have assessment practices that can measure that we have achieved those competencies and learning outcomes. So we need the assessment at the end. So it starts with engaging, convincing the stakeholders, and ends by assessing and evaluating the curricula by measuring the learning outcome achievement. Now, all of this, why do we do all of this? Because there is evidence that the patient-centered, the practice that is based on a curriculum that is made in this way will be patient-centered, will be data-driven, will be evidence-based, and the healthcare providers will produce better patient outcomes and more patient satisfaction. So let's talk about the first section, the educational feedback. Now, education feedback is, to me, a story with a lot of emotions, because during my long academic career, I heard this, bleeding complaint from the students always that we don't have enough feedback. They keep telling us, when I did the dream inventory for the medical school in the traditional and in the PBL or parallel program, the lowest item in both streams was I get enough feedback for my performance. Students tell us when we interview them that we don't know what we are doing. We don't know if we are fit for practice. We don't know if we have enough knowledge or enough skill. You give us very little feedback. All we know is the grade after we have done the finals, and that is not enough. So this brings me to an interesting article that was there a few years back, Driving Lesson or Driving Test. It's by Kees van der Vleuten. Should we teach our students and train them, or should we just give them the final verdict? You fail or you pass. Get the license or don't get the license. Okay, this was a very interesting article. I mean, the title was very attractive, and especially it came at the time when we were getting our licenses as females in Saudi Arabia. So as you know, feedback is very important. It's the lifeblood of learning. If the student doesn't get feedback, as if a person does not get Venus return. So how can they function? How can they keep on improving and be without knowing what is missing? And this saying is by Roundtree. Let me tell you a very important event that happened around last decade, maybe 10 years back. A group of psychologists, educational psychologists, came up together and they went and analyzed and revised 63 years of educational research, looking for what makes feedback most effective. That was the only objective they were looking for. And through their reading, they came up with so many factors that affected feedback. But the one that was the greatest in its impact on the value and effectiveness of feedback was trust, which you see at the tip of the pyramid. And by trust, we mean trust in the feedback giver. So if we know that this instructor has concern for our welfare, he has concern for the patients, we will take anything they say as, something that is valuable, and we will follow and we will accept anything that he tells us. If it is otherwise, then that feedback will be useless. One of the things that our students told us, we feel we are have a blind walk from the day you accept us into the medical school till the day we graduate. We don't know how we are doing, how well we are going to be as physicians, what is missing in our knowledge or in our skills. And they tell us that we keep on struggling. We keep on striving and contriving to improve our grades. All we wait for is the test results to see the grade we have obtained. And there is a big fear that we might fail because we have not enough guidance throughout our education. And that was really sad. It really made my heart very heavy. Now, this was a study that I've done in 2010 on education and environment measurement. And this is the one I was telling you about. It was about two parallel curricula for medicine. One was traditional, compute flexenarian model, and the other one was a problem-based learning modular. But both of them said that feedback was not enough or was lacking. It was a priority, it was less than 2.5 out of 5. So let me share with you, let's not reinvent the wheel. let's look at what is the world doing. In Harvard Medical University, for example, there was a big interview by JAMA journal, and they interviewed the dean of Harvard Medical School, saying to them, do you allow your students to use AI or do you ban it? What about the ethics? And the dean has said it very clearly that we encourage our students to use AI. We actually give them the tools and subscriptions for those chatbots, and we ask them to interact with the patient. Ask the patient the question, take the history, examine the patient. But when it comes to writing the notes, let AI help you with proofreading and with proper management of those tools, of the reports. So the reports will be up to the mark. In Stanford University, they demonstrated that positive feedback of AI improved teaching practices. And there was literature coming that there's educational empowerment by using AI. So all of this tells you that the world is actually now for using AI in education. Let me just give you a brief of what the dean of Harvard Medical School said.
May inherently be structurally biased. Now, why would that be? Well, as we know, ChatGPT and these other large language models are trained on the world's internet, so to speak, right? They're trained on the non.
Can you see the video?
And remembering the.
Is the video clear?
No, we can only hear the audio,
Which
Dr.
are more beneficial toward knowledge integration,
and
knowledge analysis, and interpretation, and help students with oral presentation skills.
So it's not as much that we have to memorize everything and just have all of that knowledge transferred to us. It's more the medical education is focused on the higher order skills of integrating that knowledge to try to make a clinical decision.
Exactly. And I think coming up in these next few years, we're going to have a similar transformation.
Well, it is an interesting time for medical schools. And you recently wrote an editorial that accompanied what JAMA publishes every year, the demographics of the students in medical schools in the US. Your editorial focused on how AI is going to transform medical education. And I wonder if you could just give our listeners and viewers a sense for what that editorial is about.
Yeah, and Kirsten, I think this is about to be a major inflection point in medical education, akin to what we experienced when the internet and internet search engines became available. The internet was around when I was in medical school in the mid-1990s, but it wasn't really a source of medical information. Certainly as students, we didn't go to the internet to help in our courses or help to learn material. But when search engines became available, it became clear that access to knowledge was so much easier and cheaper and simpler than it had been before. And what many medical schools around that time did was evolve their curriculum from one that emphasized lectures, which of course are very efficient ways of transferring facts and knowledge, to small group discussion formats, which are more beneficial toward knowledge integration and knowledge analysis and interpretation, and help students with oral presentation skills.
So it's not as much that we have to memorize everything and just have all of that knowledge transferred to us. It's more the medical education is focused on the higher order skills of integrating that knowledge to try to make a clinical decision.
Exactly. And I think coming up in these next few years, we're going to have a similar transformation, which is that what generative artificial intelligence, these AI tools like ChatGPT can do very effectively is summarize and even analyze and even make probabilistic decisions for us using data that we provide to it. And so like what happened years ago, I think in undergraduate medical education, we need to similarly evolve our curricula to reflect this new era in which our students, of course, still need to learn the fundamentals. That will never change, the fundamentals of how to be a doctor. But more quickly, we can move our students toward doing even higher levels of cognitive analysis, higher levels of understanding the individual patient nuance, which I think might still be difficult for AI to handle, higher levels of compassionate and culturally competent communication, which we know AI might have some difficulty with, and returning students to the primacy of the physical exam. which, as far as I know, chatbots are not going to be replacing in the next few years. So in other words, what I point out in my viewpoint is that we need our students to be even more human in their doctoring skills than ever before, working at the highest levels of cognitive analysis, the most personally nuanced forms of communication, and remembering the importance of the actual laying on of hands.
So wonderful. I like that's how you end this editorial, to be even more human. Let's take those three elements together. So we already know that that things like ChatGPT take tests pretty well, but you're challenging us that the medical student then of the future will need to be not just about building this fund of knowledge, but have to be even better at integrating and figuring out how to synthesize that knowledge for the types of clinical decisions that are being made. So they might rely on ChatGPT for a first order, but they have to be even more better using their human skills at figuring out how to integrate that for the patient. ChatGPT also it communicates. It seems to be very good at being empathetic, but you're challenging us to be more human in our communication skills that we're teaching medical students. And then the physical exam, which presumably these Gen AI tools are not going to ever be able to do.
Right, exactly. So as an example, we know that ChatGPT, when given a set of signs and symptoms, can produce a fairly good differential diagnosis. And that's something that we still need to teach our students, but maybe more quickly than before, we can move our students to a level at which they're working with that differential diagnosis to make it individualized to their particular patient, to take into account some of the particular.
Yeah, I mean, you can refer to this on the YouTube, but I just wanted to actually know that even one of the best medical schools is actually using AI and encouraging their students to look at it. This is the version of Stanford University.
Artificial intelligence can spark either hope or hesitation, especially when it comes to healthcare. But it's already being utilized right here on the Stanford campus and in clinics, from cardiology to ophthalmology. How is AI, the algorithm, used in your clinic?
In the past, when most people think about individuals who care for their diabetes, you're thinking about poking your finger and getting a blood drop and putting it on a meter, but that's not the case anymore. Right now, most individuals living with diabetes, they get to have a continuous glucose monitoring, and it gives them 288 data points in one day. So as clinicians, we're trying to really understand and wrangle all that data, and AI has really helped us do that.
So AI speeds up the process because you get the results in real time, and you can reach out to these patients in real time.
As soon as that refresh button is hit on this screen, those people who need the priority, they just go right up to the top. And there's actually a lot of data that shows that when you have technological advances in diabetes, our most minoritized families are left behind.
Okay,
So the AI has a far better outreach to these underserved communities.
So this is what Stanford University is doing. I just cannot really show the whole video. It's going to take a lot of time. I just want you to have a snap of these. And this is, I think I'm going to skip this one. Now, I will want to give you an idea of some of the tools that are very useful and I have used myself to give educational feedback. This is collection of all of them. We are going to look at some of them which are extremely, most of them are free and they are extremely useful. The first one is called the Body Interact. It's a virtual patient simulation for clinical reasoning. So what the Body Interact does is the following. It helps the student look.
Imagine bringing together the real-life pressure of managing patients with the physiological complexity of the human body in a safe learning environment that allows zero harm to patients. Meet Body Interact, the most advanced virtual patient simulator that challenges learners to practice and apply their clinical reasoning,
It's an interactive platform, so the
critical
learners are
thinking
going
skills.
to.
Body Interact enables a lifelike interaction with culturally diverse virtual patients in expert-reviewed scenarios throughout an entire patient journey. Pre-hospital care. Assist patients in settings on the street, at home.
So this can maximize the clinical experience of the students, especially those do not have enough exposure, or they are in remote areas of the country, or if we want to expose students to rare cases. For example, as a neurophysiologist, I keep teaching my students about syringomyelia, which is degeneration of the center of the cord, leading to loss of pain temperature, and how that leads to burning, and how does it manifest itself. But I myself have not seen a single case. There are cases, for example, of basonuclei degenerative condition like hemiplegismus, and I try to imitate those cases, but we can do it in Body Interact. And the beauty about it is that it's a very safe environment for the learner and for the patient. The second case is about osmosis, and this is my favorite. Osmosis is a real adaptive learning. In other words, the amount of information it gives the learner depends on his knowledge. So what it does, you just select the area you want to study or learn. For example, in my case, I selected the ear because I teach hearing, and it gives a complete basic information about the structure, the functional anatomy, and all the parts. And then it asks questions, like it asks you, can you indicate what is this? So it gives you like a fill in the blank. What is the structure that is between the dots? And this, of course, represents the oval window. And then it gives you multiple choice question to ask you about the a certain. So if you put the correct answer, it will give you the green. If you put the wrong answer, it gives you the pink or red. For example, it gives you a scenario here. 75-year-old man diagnosed with age-related progressive bilateral sensorineural hearing loss for high frequency. And we know that high frequency are usually integrated at the lower or the base of the cochlea. It's vice versa. High is low and low is high. I keep make my students in order to remember it. So for a case of fun, I just answered by mistake. I said the tip of the cochlea or the apex of the cochlea, and it gives me the red, and gives me the correct answer. But not only that, it gives you a commentary why this is correct and what is the basic information or learning outcomes behind it. Now, the third one is called Aquifer. Aquifer actually is basically concentrating on doctor-patient interaction. So it gives you a doctor-patient encounter with some information, presentation, presenting complaint, and some data. And the student will be asking for more questions that will clarify the condition a bit further. And then he start asking for physical examination findings, and then for lab findings. And finally, the student is asked to give, for example, he can ask for ECG, electrocardiogram, he can ask for certain radiologic scans, and then he is asked about the differential diagnosis. So it's exactly like as if you are seeing patients. And this will never replace the real life encounter. But the issue is how many, with this very high student-patient ratio, how much each student is having as an experience. So this is to maximize, this is to give a chance for ideal kind of presentations, which is textbook kind of presentations. The second one is about radiology training. It's called Radiology Readiness Assessment, or RAD-8. And it is used for undergrads as well as radiology residents. Here, we prepare, when we can design a course, and then we train the students on certain radiology scans, and then it can give you the analysis to how much ready these students or these residents are for to pass this module or stage in residency. Sometimes there are conditions that we don't find a radiology scan for. So this helps us in proof, training radiology as medical students and radiology residents. Now, this one is a powerful one, surgical skills training. It's called CSATS. This one, I hope I can show you.
CSATS is an AI-driven surgical data management platform that provides consistent and objective expert feedback and clinical analytics designed to improve surgical proficiency. With CSATs, you can efficiently capture and store your surgical videos for future review, reflection, and learning. Using our proprietary interface, you can record, save, and send your videos to our high-trust CSF certified platform. CSATs also offers feedback, insights, and analytics related to a surgeon's skills and technique. View a personalized and private dashboard, track your performance, receive unbiased feedback from expert surgeons within your specialty, and view in-depth analytics on technical skills. CSATs facilitates personalized learning and sharing. Access thousands of videos in our academy. Watch and learn from expert case studies. Compare your videos with others. And connect with an online community of peers to exchange insights and ideas. We believe that if you elevate surgeon proficiency, you can improve patient care and impact the metrics that matter.
I think those are very powerful numbers that we have just looked at by using these simple tools, AI empowered tools like CSATs. So what it does, it gives, you can upload your video and get feedback, complete feedback by experts in the field. You can watch videos by expert surgeons, and you can compare your protocol and a certain procedure.
Dr. Mona, sorry, can you please just raise your voice a little bit?
Okay. Okay, so you can upload your own video to the platform and get elaborate feedback by expert surgeons. You can compare your procedure with somebody, with an expert in the field, and you can get an analytic of your performance, dexterity, or your surgical procedure skill. There is the second version will give you a skill development plan. So it gives you a plan of how to reach from a novice to an expert, and will track your progress and tell you whether you are actually progressing as expected or you have to do more practicing. So CSAT is a very powerful tool. Now, ITS is an intelligent tutoring system. I mean, we do have advisory systems in our colleges. We instructors, for example, each instructor in my college has like 10 students to advise. We do have tutorials, but are we there 24/7? No, AI can provide a 24/7 intelligent tutoring system. So my daughter now is preparing for the Saudi medical licensure exam. And whenever she comes with she's preparing from, like big banks of questions. Sometimes the answer to the question does not make sense. So she puts it through the AI chatbot, and she gets a complete commentary why this is the correct answer or why the other options are not. So ITS is a very useful. Another one is called MidTutor. It's an intelligent tutoring system. Some of them are even supporting for psychological kind of. So if you are disappointed with a certain score, if you have a conflict with an instructor or with a colleague, you can just put that problem to the AI, and you'll get enough, a lot of support on how to tackle that problem. So in MidTutor, it will increase the clinical acumen, it will mentor the learner, and it would even support with research. Now, Isabel is I like this one because the main emphasis in Isabel is the differential diagnosis. So what it does, it gives us complete scenario with history and physical and asks for differential diagnosis. And then when you select the differential diagnosis, it tells you why the order of differential diagnosis should be changed. Why one of the differential is more likely than the other because of something, maybe the age of the patient, maybe the background of the patient, the education of the patient, the occupation of the patient. So it links all these specifics, personalized conditions of the patient with more likelihood of any of the differential. So it's really very useful for clinical reasoning. For example, here you can see this differential diagnosis. This is one case, and these are the differential for that case. I don't want to go into details because it will take us forever, but you can open it. It's a big portion of it is free. It's called Isabel. And the amount of knowledge you can get, even if you are already certified, is really a lot. I really like to play with these things. Now, WooBot is an AI-powered questioning answering systems. And here, it was originally a mental health chatbot. So it was made as a cognitive behavioral, as a, psychoanalysis and psycho treatment, but it can be used also for medical learners. So it has been adapted for medical education. So it uses AI to engage students in a question and answers. So the questions come from both sides and the answers can be also exchanged. I have just read a paper, which is not yet published, it's been accepted, which compares the 5 large learning models in answering questions of medical students to the human instructor. And then they asked the feedback of the learners about which feedback they preferred. These 5 chatbots included ChatGPT 4.0, Cloud 3, Gemini, and 2 other large learning models. So the students found, and they are blinded, they don't know, but they got the answers from all these different sources. They said that ChatGPT 4 was the most accurate. Cloud 3 and Gemini were the most elaborative. And to my surprise, they thought that the answer they got by AI or the large learning models was more understandable than the one they got from the instructors. I mean, we expect that the chat or the AI will be faster, will be more elaborate, will be more accurate. That is well, but to be more understandable, that to me was a surprise. But this is a real search, which is, very soon it's going to be published, inshallah. Now, language processing, it's called TalkSpace, and this is a platform originally for therapy again. So now the last 2 are for they have been used for therapy, but now they are adapting for practicing patient communication. So the student or the learner can practice breaking the bad news, or for example, explaining something, and the AI can analyze and give a detailed feedback on the language, the level of empathy, the skill in communication, the clarity of the message, and so on. Now, let's talk about assessment. I think I'm going to need extra time, Dr. Musa, if that's fine. We just finished one.
I think it's very interesting. And actually, you are summarizing your, experience and the journey that you have been through. So that by having more time, I think if you other colleagues are agree with me, you are saving us a lot of time because you have done your research, you have done your exercise, and you are giving us, the final outcome. So please go ahead, take as much time as you think appropriate.
Thank you. Now, in assessment, we have experience with a program called Tabahuth. It's a summer research course. We take, candidates like from 80 to 160 students. They come during summer in 2 groups, and we use the flipped classroom technique. So we recorded. Let me tell you about Tabahuth, and then we'll come to the other 3. So in Tabahuth, the objective was to create a research proposal and an IRB approval or ethical approval from the committee. And then we have applied AI in the biomedical technology, master students, and in correcting the essays for the assignment called the student project case. So the story of Tabahuth, as I told you, it's a summer course. We use a flipped classroom, which is a flexible learning, intentional, professional. In other words, we recorded the basics of research on video, very high-tech video that were made in our studio in the university. And we posted those on the platform for the students to learn before coming in the summer. And we used Socrative to create a pre-post test design to evaluate their basic knowledge before starting the course. and then evaluating it after the course. During the time, the face-to-face time, the students received a lot of activities to ensure that they have actually grasped what they learned from the videos. And we had a Padlet wall as a common platform between us and the students. Let me see if I can show it here. I'm not sure if it will. Yeah. So a Padlet wall is just a platform which actually, and you can organize it in any way you want. And you can ask, you can put the students just have to double click and write their opinion about any kind of comment they want to say. It can be anonymous, they can put their name. So they can put, and the beauty is that it's not only between the student and the instructor, but it's also between the student and other students. So it's like peer instruction. So if the student found something very interesting or very useful, they can post it for their other colleagues. So we found this very useful. And then, yes, we told them about a lot of tools that can make their journey during research more smooth. And my favorite is SkySpace. I have a subscription to that. It's a very useful tool to help you with the literature survey, with summarizing the articles, getting the main, for example, conclusion from each article, with giving a summary about a certain topic, and even formulating your research question. So if you have an idea in your mind, you just put it in the gap. I wish I can actually demonstrate that. And then it will give you how much is available about that certain tool.
So SciSpace Copilot is an interesting AI tool that has been incorporated into SciSpace to help you research more in a better way. So you don't have to be navigating around different tabs, searching or Googling different kind of concepts or ideas. With SciSpace Copilot, you can be able to do everything from summarizing a text to rewriting or prompting it with different kind of questions that has to do with a particular research paper that you're working on, to even understanding and explaining equations and concepts, even tables. It goes beyond equation to even tables, and even you can explain any given picture or image for you within a particular paper by just highlighting it. It will explain everything for you. So this next level AI, I've done a video about the launching of Microsoft Copilot. I think SciSpace have done a good job in incorporating it into its website or into its research features. So you can have access to the SciSpace Copilot by just coming to your Google and just searching for SciSpace Copilot, and you can see it over here.
Yeah, you can look for it, but believe me, if you get used to it, it's an extremely useful tool. And students ask me almost on daily basis about certain topics, whether there is a research gap there, because now students are very keen to get patents, and they want to really, especially those with PhD, on PhD. So during the time, the face-to-face, we had in-class activities to make sure that the students were actually grasp what we recorded in the videos. And then they went into small groups with a mentor, and they had certain specialization. So the outcome of this course was that we got 16 research proposals, scientific research proposals, and we have created research interest groups. So some groups were interested in neuro, some of them were interested in stem cells. So that group was already formed, people out of students and a faculty. Something that we got, by the way, which was not planned for, is that we got the learning needs of the mentors, because the mentors of the faculty, most of them were, those who came from scholarships and have not yet been involved in teaching and learning. So they came to us and they said, we also don't know. For example, our students are asking about sample size measurement. How do we do that? So we started collecting those learning needs. And then research methodology knowledge has increased markedly within all. And we created a student-directed learning and interactive kind of learning. So to us, it was a very a big success. So now the issue is, we found that the pre and post test that there was an increase in the basic knowledge of research from 60% to 90% as measured by Socrative. All we did was 10 MCQ questions, but they were critical questions that we will only answer if you really understood. So this was the first impact. And we thought that we got that from the lectures, the recorded lectures, from the activities, and even from discussions, and from the practice in creating the research proposals. And the students, verbally or qualitatively, they said that we were very confused, and now we feel that our journey through research is more clear, and we know the steps for research and how to reach at the end to publication. We created a rubric for evaluation of the research. So the issue was, the 16 proposals, we had to give 3 rewards to the best 3 proposals. And now, how can we evaluate the research proposals? Now we have a form in the university, they have used that, they filled it. So we created a rubric using AI. So we asked the GPT-4o to create for us a rubric to evaluate a research proposal made by medical students and on these categories. And so it created us a detailed rubric. Then we started scoring those rubrics, those proposals. So we uploaded the rubric to the ChatGPT-4, and we said, okay, we want to evaluate those 16 proposals. Now, I repeated this evaluation 3 times just to make sure that the ChatGPT-4 was actually giving a reliable kind of scoring. And I found that it was the difference between each scoring and the other was not more than 2%. So the scores were between, for example, 94, 96, 94, 92, like that. Then the beauty of the AI is to give a narrative feedback. So to each proposal, we could create positive SWOT analysis, strengths, weaknesses, areas of improvement. And then we ask for human scoring. So we send the proposals to judges, and we found that there was a high correlation between the human scoring and the AI scoring, which gave us more trust or validation of the AI scores. But the problem with the human scoring, they had no time for any narrative or any areas of improvement. And of course, the SWOT was not done. But this made us feel more confident in using AI in evaluating them. And of course, the end result was that 3 proposals won, and we gave them recognition and some financial rewards. So the second thing is using AI to correct essays. So I was using this for the biomedical technology. Master students, they were asked to create a report, and each report was about 20 pages. So I would read the report, and then I will upload the reports plus the rubric and ask the AI to give me scoring, first of all, evaluation according to the rubric, and then feedback, narrative feedback, and then scoring on each category. So the benefits is that it's very fast. Within 5 minutes, it can do. It is consistent because if you repeat it, you get almost the same responses, and you can handle a large number of essays, and you can actually help in telling the students how they can improve their reports. In my case, I had only 3 students for the masters, but one of them was very nice to me. So I was afraid that I would be biased in evaluating her. And it turned out that that student had the lowest score. I had that feeling that she did not do so well, but AI confirmed my feeling. Now, let's come to the important question or issue of ChatGPT as an item writer. There's a lot of talk and literature on item writing by AI, and there is a ChatGPT called Full Exam by ChatGPT. So you need to give a prompt which has this PREP acronym. So in P, it means you need to frame write the information essay about AI in education. The R is for the role. What is are you the author? Are you the what is your role in, or what's the role of you are giving to the AI? Are you expert in higher education? Are you a neurophysiologist? Are you a nurse? And so on. The E is for explicit instruction. The essay should include some so on and so on. And the P is the parameters. What is the length? How many words? How many pages? And so on. So you need to give very clear prompts to the AI in order to get a good output. So, you need to give the task a clear, concise job description for AI with an action verb. You need to give the context, the role, the output format. Do you want it as an A type, R type, script concordance item? Tell how many options you want. Tell if you want to specify the learning outcome before the item and to give a key answer after the item. And the newer version, now the literature tells you that AI are not so good in item writing, but they can produce quality items. But the problem with AI is not, it is not well informed about the key features of clinical cases. So the latest literature has combined ChatGPT or Gemini. Gemini is actually is highly involved with item writing, and it is said to be more accurate. But if we combine the Gemini with an automatic item generator, the one we used to use, 1 decade before, and because the automatic item generators, they have embedded with them the illness scripts or the algorithms to clinical reasoning to reach a diagnosis. So if we combine these two together, we get the best quality items. And you can attach the course objectives. You can attach your checklist for quality. You can attach your cutoff points for the item indices. And you ask AI for any additional details it needs. And you can even ask AI for items that cannot be answered by AI. So the students will not be able to cheat. So this is a summary. Desired format, patient details, complaint, relevant history, physical examination, and you ask them, write a case-based question on a diabetic patient, for example. We use AI in creating multiple choice question, creating essays, and I used it also in correcting the essay that is produced in an assignment called student project case. This is an assignment that third-year medical students produce on a yearly basis as teams. And for example, my team this year is doing bipolar depression disorder. Last year, they were doing stroke. So each year, my team, they have a different topic. And at the end, I will be scoring essays by other teams. And my team will be scored by another instructor. And we also give the winner some reward. So how does AI help us in healthcare? Now, in a nutshell, it can help us enhance the diagnostic precision because we all know, for example, for a certain presentation, these are the differentials, but a personalized diagnostic criteria for this particular patient who is coming from this background, who has this family history and who has this occupation and these habits, what is the personalized differential diagnosis? We can do data-driven rationale, which means based on the prevalence and incidence of certain diseases, how diagnosis can be changed. And it can help us in probing and inquiry, okay? So it will help us ask proper questions to clarify or elucidate the proper diagnosis. So it is more precision in diagnosis, more evidence-based reasoning, and more critical thinking development. So our learners and our patients actually are getting better decisions and better treatment. Now, this is just to summarize how large learning models or AI models help us. So here you feed the large learning model all the information you have, blood test, X-ray, genetic, and it gives you in return the personalized diagnostic, prioritize, the personalized treatment options, and the prognosis for this particular patient. We, during Corona pandemic, we were faced with this challenge of deciding which patient needs to be admitted and which patient can go home. So we wanted to see the severity with the radiological scanning. So we used to do chest x-rays and CT scans, but sometimes the glass ground appearance was not very clear, and it used to be mixed up with pneumonia. So we created a large learning model that differentiated normal chest and CT scans, x-rays from pneumonia and from COVID-19 patients. And the work took us like 3.5 years. First of all, we started collecting x-rays from hospitals, but that was not enough. If you want to create a large learning model, you need to actually have tens of thousands of x-rays. So luckily, there was a library that is available online with all of these x-rays, radiological scans. So we used it, and the glitch there was the image enhancement. So I had the team with a mathematician and an engineer, and they created with a differential calculus kind of model, an enhancement of the images, and we got an accuracy of 98.3 or 4%, which we are very proud of, and it was published in scientific reports in Nature. So the title is Multi-Class Deep Learning Architecture for Classifying Lung Disease from Chest X-ray and CT scans. What we did was those image data sets, which are available online, we proposed the image, we customized the CNN and pre-trained this is the name of the library, BG16net, and pre-trained, and we found that we could the machine can classify the X-ray or the CT scan into normal, pneumonia, or COVID-19 with 98.4% accuracy. Right, this is a nice, this is a very recent article, I think in 2024, just last month or something. Yep, this is 2024, July, or is it? Oh, yeah, I think it's 7th of October, October 28th, yes. So just less than 2 months ago, large learning model influence on diagnostic reasoning, a randomized controlled trial. In this one, they compared the physician, the trained physician or expert physician diagnosis versus the large learning model diagnosis. And they found that large learning model alone demonstrated higher performance than physician groups. And this means that we really have to involve technology in the workforce in the hospital, and that we need to train our physicians to use AI. But they said that the use of LM did not necessarily improve diagnostic reasoning of physicians beyond conventional resources, but that we need further development to incorporate large language models and make them more informed about the illness scripts or the algorithms to reach diagnosis, so that they'll be more useful in diagnosis. This is also another recent article in 2024. I think it was 25th of October. This article came from Japan. And they find something very interesting, which I cannot explain. They said, if you put this phrase, this is a quiz, then it will improve the accuracy of diagnosis of large language models. Why? We don't know. So what they did, they compared, they give the text clinical history and images and all the information of 150 cases. Sometimes they put it without any information, and sometimes they write, this is a quiz prompt, just this 4 words. And they found that if they use with ChatGPT 4.0 or with Cloud 3.5, that the primary diagnosis, differential diagnosis, and differential diagnosis 2 was much more accurate if they used, this is a quiz. Very funny, right? But this is what they found. So we need to learn, what are the nuts and bolts of these machines. So we're dealing with a machine. We need to know its secrets. It's so to make the best, to get the best out of it. Are there challenges? Of course. You all heard about the bias, and the bias does not mean the machine will like this person or this person, but according to the data, it has been fed into it. So for example, if I have data of Africans with Black origin and more than whites, then the machine will diagnose Blacks more with this disease. There's lack of privacy. We put the data there, and if I put name and contact information and so on, and some private information, we don't know what happens to it. There is no insurance whatsoever about the privacy. And then the human context. Patients still prefer to have an empathic a person or human interaction or a physician to take care of them. These are the bias in machines is of 10 types. I will not discuss them, but I leave them to you to look at them. So there are so many types where the machine can be biased, but still, I think AI has a big role in education, in assessment, and in, this is a magnification, in education, in assessment, and in healthcare. So here it's talking, for example, about AI over-reliance syndrome, automation bias, algorithmic empathy gap, data tunnel vision, confirmation bias, AI generalization jump, feature fatigue, privacy contemporary, and temporal myopia. I will not go into details, but I want to tell you this is the state of the art now. But every day, every hour, actually, there is a new development. This is why when they say AI, I feel a little bit irritated. We should talk, which chatbot are we talking about? There are new tools, new chatbots, new platforms created every day. So we have to be, we have to follow up. And I think all of these problems will be tackled. For example, the problem of hallucination was to a large extent minimized in the new chatbots. And we need to be on top of those. So the take-home message is AI is here to stay. AI does not replace human judgment. Teachers and learners should be trained on the use of AI, and this will not happen unless we incorporate it into our faculty development programs and into our curricula and into our competency framework matrix. Generative AI can transform the way we learn and assess. Thank you all for listening. I know it was a bit long. These are my contact details.
Dr. Mana, thank you very much. It was very engaging, very informative, and it summarized a lot of efforts you have done over the past few years. I'm sure our colleagues here, because we have a wide spectrum of audience from the medical school, from the dentistry school, from IT, from engineering, and we're glad also to have so many students, and because our medical students are top-notch students, and now in addition to the medical skills, now they are learning Python as you have done yourself. So as I can say, 3-in-1. So they can do the medical diagnosis, they can do the programming, the analysis. So they have all these set of skills together. Thank you again, Dr. Mona. Now we'll have the floor for questions. If you allow me just to start, the role for the questions with two basic questions from my side. And I'm sure our colleagues here, the attendees, because I know many of them, they have also many concerns or many, inquiries. The first one, regarding the tools, Dr. Mona. You mentioned many tools, and I appreciate that you related each tool to its usage case. Was this as individual effort or, at the institute level? Was done at the department level, or you as Dr. Mona has done this exercise individually based of your curiosity and, hope to keep learning process? That's the first question. The second question that now, because I think the ratio of students to instructors in Imam Abdulrahman bin Faisal University, if you can know more about the numbers, because in our case, maybe it's a bit more challenging because maybe we have higher ratio in student to instructor. So how we can deal with this challenge? And I'm sure that we'll have other questions from other colleagues. Please, Dr. Marwa.
Thank you, Dr. Musa. I think at the moment, we don't have a structured entity who is in charge of AI. I mean, there are efforts from the Deanship of Academic Development, from the e-learning Deanship, from the library Deanship, but there is no official entity who is in charge of AI. So at the moment, we are doing personal efforts, and these are my own efforts to improve my students' learning. But I am a faculty developer, so whatever I find, I actually share with all the medical school faculty. And sometimes we have also faculty from the health profession colleges, because I teach in 6 health profession colleges. So that's to answer the first question. I am waiting for the moment, and I heard that there is a decision by the NCAA that there should be an AI unit in each medical school, and there will be the head of that unit should have an AI background. The second question.
But just to let the other colleagues know, NCAA is the entity in charge of equality in Saudi Arabia. So they say that each medical school should have an AI unit, and okay, and what else?
They'll be in charge of promoting, the practice of AI or the incorporation of AI into learning and assessment and research.
Yeah.
The second question was about, can you remind me, Dr.?
Yes, about the ratio of student to instructors. Yeah.
Well, the ratio of student to instructor in my college is 5.7 or around 6:1. This year, I used to teach, for example, 130 students in one class in medical school, 2nd and 3rd year. This year, they jumped to 230. So, and the same thing goes for nursing. So nursing, they doubled the number this year. So I am expecting the ratio to come like 10 or 11 to 1.
Yes. So, I mean, how it's different regarding having customized feedback, because maybe with larger ratios, it's more important to have customized feedback instead of doing this manually. So we could do this with the help of AI. I think with larger ratios, it's even more important.
Exactly. And even in the future, we might even get more student-faculty ratio. So this is why we want to equip our faculty with the knowledge of the know-how, how to train the students to use AI feedback, because we cannot be there for them 24/7. I mean, my students contact me by email, by WhatsApp, and I actually reply to them, but not all faculty are doing that. And I mean, sometimes even the students want to study at 2 a.m., 3 a.m., and I'm not there for them. I mean, I can see their questions and queries 2 hours, 3 hours late, which is not good enough. So AI will be there with them all the time. And it's like a personal assistant, not only a tutor. So it can help them on personal reasons, personal issues. It can help them on mental prompting, mental support, and also give them detailed feedback to their performance and explain things to them. I told you my daughter is preparing for Saudi medical licensure exam, and I introduced her to chatbot, and I told her, please use it, it's going to help you. And she found it, she said, I don't know what I was doing before that. So it gives you the reason why this question was answered in this way. What is the background information that she needs to know in order to understand the answers and so on.
Yes, thank you. Can we have questions from our colleagues, Dr. Alama Talqa, Dr. Leila Tutanji, Dr. Thukaina, Dr. Omar, Dr. Najla? I know many names from medical and dentistry schools. So the floor is open now. And actually, we'd like to make this meeting like a starting point. So if you have an idea in your mind, and we took the permission of Dr. Muna to record the session will be recorded. If you'd like to refer to it again. So maybe if you have an idea in your mind, we can work closer, on this idea and make it like a product. With the medical expertise and the programming expertise hand by hand. So we're happy to receive more questions. You can write this in the chat or speak. Please go ahead. Yeah. Dr. Najla. Dr. Najla is a very active colleague from the dentist school. My students use ChatGPT to study for their lectures. Unfortunately, some of the information is not accurate. That terrifies me. You mentioned top-notch schools advocating the use of AI, and I know we are going that way. But are we now ready? Very important question. Thank you, Dr. Najla.
Yeah, it's a very good question. And, you know, we need to alleviate the fears of the use of AI. I know there is a lot of hesitation. And even my faculty, they say, we don't want our student to use ChatGPT. If they use it, then if we make the items or the questions of the exam by ChatGPT, they can also put the learning outcomes of the course and find out the same questions. And my response to them is always, please, it's a tool. If you look at it as a disruption, do you know what was the first disruption of learning? Does anybody imagine what was the first tool that we thought will disrupt learning?
Dr. Omar says Google.
Much before that.
Internet. I mean, in the classroom.
In our days. Sorry?
Again, I think maybe you mean something in our day life on the classroom.
No, much more before our day life.
Internet?
I mean, internet came when I was, you know, a graduate of medicine. No, I'm talking much the first disruption of learning and teaching.
Radio.
Sorry?
Radio.
You're getting excellent suggestions. Even much.
But I think she means something that's more basic.
Yes, Dr. Musa, you're almost very close.
Yeah, like
what?
Pencil, writing, speaking.
Writing, beautiful. Writing was the first disruption. And at that time, there was a great resistance to writing. And I think it was at the time of Aristotle, he said, if people write, how can they remember? How can they learn? So we have this hesitance and apprehension towards anything new. So AI is just like that. Believe me, it's going to be a very useful tool in our hand. It's not a perfect tool at the moment. It's being developed. And people, you don't know how much work is being done to develop those platforms and make them useful, accurate, reliable, and valid. So just give it some time. If your students are using, maybe they're not using the proper one. They have to use ChatGPT 4.0, Cloud 3.5, Gemini. Those are the best ones, or the tools I have just mentioned. Most of them have been already informed about a lot of clinical cases and information.
Yes, thank you. Now we have another question from Dr. Luaid Taraune. He is, the chair of Computer Communication Department, Engineering School, Ibn Sumaya University. Thank you for the very interesting and insightful talk. Do you think AI in the context of collaborative learning can effectively facilitate a group discussion or projects by offering ideas, clarifying concepts, or mediating debates? Also, how do you see the ethical implications of relying on machines for such a process? I'm curious about your perspective on this.
Yes, that's an excellent question. Actually, I ask myself the question, how can AI help us with collaborative learning or collaborative practice? I think the barrier to collaborative practice is our ignorance of what is the professional identity of the nurse or the respiratory therapist or each member of the healthcare team. Our knowledge of their scope of function, their limits, which they cannot go beyond, is what hinders collaborative practice. So I think AI can help us in that. And a lot of this comes from embedded knowledge about the professional identity of all of these healthcare team roles. So we need to, but of course, AI can be used as a platform to interact with those, the other members of the healthcare team. But there is a very strong evidence, and this was presented in the Saudi International Medical Education Conference last week. There is a very strong evidence by John Gilbert, who came from British Columbia. He said there is very strong evidence that collaborative practice leads to better patient outcome and better patient satisfaction. And that's what we want. That's the ultimate goal of all what we are doing. All we need is that the patient will be satisfied and will have better health. But how does it do exactly? Maybe it's something to look into. I think, in my opinion, I have not used it myself, but I think it clarifies or demolish the gaps between the different identity roles and allows us to know what are the limits for each role, what are the scope of function, and so on.
Yes, thank you. Well, I'll still, have time to receive more questions. Now I have another question that, actually it confuses me. What's the best way to go? Now, in the medical school, we have very much interest in medical education. Is it better to have like, specialized medical education department as you have done in your case, or the other way around? I know because I worked with them closely with King Saud University. They have a specialized education department, and who's working there are people from the IT background. Also, maybe we can ask our colleagues from the education school or education department. We have many options. Who do you think are the best people to be in charge of or to work closely in the medical education department? I know we have debates about this, we have different experiences, but which case you think is the best way to go?
This is a sensitive issue, but
Yes.
we cannot make use of educationists in the medical education department. Medical education is a specialty on its own. We had a lot of pressure. I was the chair of the medical education department, and I had a lot of pressure to include people from the education college into our department because one of them was the son of the dean. So I had a big resistance to that. I said no, because I tell you why. Educationists are on my head. I do respect them. They have, and because I love learning theories, I love education, psychology, and actually the psychometrics came from the education only. But the issue is their scope is so different. And, in for example, the Deanship of Academic Development in our university, they developed the whole university. So they put a lot of topics on teaching and learning and assessment. But when we listen to them as medical or health professionals, we don't gain anything. We need things that are related to our work. So medical education is a completely different specialty from education. That's number one. Number two, to have an engineer in the department, I think it's not doable, but we can collaborate if you have within the university. For example, we have an IT college. So information technology college, we have engineering college. We get, a lot of collaboration with them to have combined interdisciplinary research and workshops to get, we had like a big workshop where teams from different health profession colleges, and in each table there was one or two engineers, IT engineers, and we had a lot of projects that came out of that. Some of them got patents.
Yeah, thank you. Now, also, our colleagues asking for the recording, and we took the permission from Mona to provide you with the PowerPoint and the recording as well. Dr. Leila Tutanji, and she's very active. She's a very dear colleague from the medical school, and she's looking forward to initiate further collaboration. Inshallah, Dr. Leila. We have a question, or also a concern from Dr. Tahani Al-Khatib, who will get her PhD in AI philosophy and ethical AI. There are many ethical concerns using AI in learning, especially in plagiarism, reducing human creativity, laziness, unwilling to learn patiently in the first place. Of course, AI is a great tool, but there are questions about accountability and responsibility. And what about trust? Also, is AI an autonomous entity that has free will? AI has many potentials, of course, but more research is needed in the field of responsible AI. Yes, absolutely.
I totally agree, but let me tell you one thing. Now, when you correct an essay in an exam for example, in a medical education curriculum, do you actually penalize the student for grammar or for spelling mistakes or for comprehension? We usually don't. We just, take the content.
If it's not a language course, we don't. For a language course, we must.
Exactly. So if the student uses AI to prove his writing, what is the problem with that? And we
Yeah,
can, if we are looking for language, then we can easily detect it by ChatGPT 0, which is freely available. And believe me, now there are a lot of platforms which can humanize AI output. So they can
exactly.
take output from the AI, humanize it, and you will never be able to detect it. So why bother? Let them use it. Let them use it. If they have a problem with language and they want the AI, just like Grammarly, it can, spelling mistakes are a big disgrace. Sometimes you get an email with 10 spelling mistakes just because that person is not a native speaker of English. So let them use
Yes,
it. Let them be
yes,
more proficient. Sometimes, I'll tell you something I find AI very useful on writing the letter to the editor. Now, after you finish your article, you want to persuade the editor that this is a very important area which will be of interest to the reader. So you ask the AI to write the letter to the editor with a persuasive language. And believe me, you will get a very convincing letter to the editor. I think that, to me, that was very useful. So students can use it in that way. They can use it in writing emails. They can use it in communicating with, for example, sponsors for the research. Let them use it. We need to encourage them. We need to empower them. Don't
yes,
put obstacles in their way.
yeah,
And believe me, they will get, even if there is harm, then the benefit is much more than the harm.
yes. Yeah, actually, to illustrate more on this point, elaborate more, I was part of the committee that sets the rules. What are the ethical use or the eligible use of AI, and what are not the eligible use of AI? And we put some kind of regulations and forms for the postgraduate degrees. Yes, Areen, we have a question also from Areen. Uh, okay, after Areen's question, we'll have time for only one more question. So, Areen, please go ahead. Do you wish to write or use a mic? Please do whatever you like.
No, he is a mic. Thank you so much. Thank you for the brilliant talks, Dr. Mona, Dr. Hamza, for this great opportunity. I'm Areen Shdefat, a second-year math student at University of Jordan. And basically, we're initiating a group which called Med AI Community, Clinician Community, where as students from يعني كل كليات الطب بجامعات الأردن, we're trying to just let the students know more how could they use AI in a much reasonable way, legal way, and how could they benefit the most. For me, as Areen, I find it so helpful محاضرة اليوم, so thank you so much. And we're looking forward to collaborate معك دكتورة منى ودكتور حمزة if you have time to visit you.
انا اسف، موسى الاخرس، انا موسى الاخرس، جوز حمزه كان في
دكتور
زميل.
موسى.
طبعا بس احنا هدف الدسكشن اليوم يعني نفتح فرص كولابوريشن صراحه، وحسينا في فرصه would like to sit together to see the best way to go. يعني صراحه we need this session to go forward and have a product. Because Dr. Mona has gone through a journey with ups and downs. I'm sure about that, and we need to make our trip shorter to go about the best practice, what worked, what didn't work, how we can make a product that's useful in our universities. That's the purpose, the main aim of this session for knowledge transfer, because the session was about 1 hour and a half, but I'm sure these things took from Dr. Mona many years to learn and practice and try things that didn't work and other things that worked already. Yes, for sure. We'll be happy to.
I'm very
Thank
glad
you.
you're doing that, Areen. I really encourage you to do that because you cannot learn on your own. The more you are collaborating with others, the more powerful you will be. And hopefully you will even create a chatbot on your own. To create a customized chat with GPT, it's very simple. It's much simpler than you think. And I can have, maybe in the future, if I ever come to Jordan, I can have a workshop to teach you how to do a customized ChatGPT. For example, I teach the foundation of physiology, how the homeostasis as a concept. And we give them examples of how the negative feedback, positive feedback, feed forward, and so on. So I created small ChatGPT just to help them learn that. So I give them the scenario, they use the ChatGPT to get feedback on the answers or what happened to a certain physiological condition. So you are the power. Students are much better than us. You are ahead of us. You know, I was teaching, for example, physical therapy the other day, the second year, and the student came at the end of the class and she said, I know Python language and I have created a program that does this and that. I said, what? Are you serious? So you are ahead of us because you are that generation that can learn technology and use it much more efficiently than us. So please use that power, do your best, and we will learn from you.
Thank you so much
for the very powerful message at the end. I think that powerful message, was the perfect ending for this very nice presentation and very nice webinar. I really enjoyed it. I didn't feel the time because we took like 100 minutes, but it was very enjoyable, very engaging, and I really learned a lot from this session. I just want to give two quick reminders. The first one, if you'd like to hear more about or to see the presentation and the recording, please follow IEEE Jordan section. We are there on Facebook. We are there also on YouTube. Just search IEEE Jordan section. And also we are planning to have a monthly seminar. It will be the first Saturday of every month. So today is 7th of December. So our next seminar or webinar, it will be on 4th of January 2025. Same time, 4th of January 2025. We announce the speaker and the title and the abstract ahead of time. So please follow us so that you know more details, and hopefully you can take this further, and we have some ready products that are useful for you and useful for your universities. Dr. Mona, on behalf of all the audience, I'd like to thank you very much for your time. It was a very nice presentation. Thank you for sharing your experience and what worked and what didn't work. And also in IEEE family, we'd like to thank you because the audience here were from medicine school, from dentistry, from IT, from engineering, from different universities. So it was very useful and very engaging. Thank you very much, Dr. Mona. Thank you everyone for attending, and have a good evening.
Yeah, Manallah.